speak and to share your story, because it's so important to battle those myths and that stigma that is all too apparent in our community. So, thanks.
It's my understanding that what predicated this on the government's part was a decision a while ago where the government was ordered to pay for a couple to have lights and equipment to grow their own medicinal marijuana. I'm wondering how you feel about this decision being based on that.
Well, I think I could speak to that. I know a little bit about the case that you're talking about, and in fact, that individual has since become my client, and she's given me instructions to speak openly about her situation. And what I can say is this:
please move
the microphone.
Yes, thank you.
What I can say is this: is that we understand from the government's own figures that the medical marijuana cases occupy maybe there may be 2 or 3 of the cases that are currently on the caseload. So, tiny proportion of the current cases. That's number 1. And number 2, medical marijuana is prescribed by a doctor. It's prescribed in situations where somebody is suffering from extreme pain and suffering and needs pain management treatment. It's prescribed in situations where every other alternative has been tried and failed. So we shouldn't view the pharmaceutical industry as having a magic wand. There's many pain conditions which cause pain and are not appropriate for medications. And so this individual that you're speaking of had tried every other pharmaceutical going. In fact, most recently, she had been prescribed OxyContin and Dilaudid. And so we've all heard about that, and we all know about the negative side effects of those drugs, not to mention all the social costs involved in those medications. She, not unsurprisingly, and her doctor, especially her doctors, wanted to try another alternative because the side effects and the other costs of using those medications were too great. And so the doctor recommended medical marijuana. Health Canada licensed her, gave her a license based on her situation, her unique circumstances. But because she had no money to pay for the medical marijuana, she decided she would grow it herself, and that would cut the costs of the treatment. But she didn't have enough money to even buy the stuff she needed to start up. So she went to the department, and the department said no. Presumably the department felt she should go back to the OxyContin or the Dilaudid, but her doctor didn't agree and supported her, and they went to a board hearing, and the board hearing said, yes, this is an essential health service, it's covered by the law, it's covered by this regulation, and we're going to order the department to provide you with access to this. So, you know, you always got to look at the other side of it. If you're dealing with services that are essential to health and you deny those services, what's the fallback? And there are costs associated with the fallback in the case of pain management. If you're going to deny somebody access to a proven treatment that works, like medical marijuana, you're going to force them back onto something that doesn't work nearly as well and has many side effects, like OxyContin and Dilaudid, and you're going to be, again, as you know, going back to what Dr. Casey said, looking at far more cost, you know, quite apart from the individual, you know, pain and suffering from not having access to the right treatment, the cost to the system of, you know, unnecessary emergency room admissions or, you know, other pressures on the healthcare system. So I think the medical marijuana, that was definitely the spin put on it by the government last week, but I think it's entirely misleading. I think we've heard today that it's essential health needs across the board that are affected. You don't scrap a program because you disagreed with a couple of the cases that were offered under the program.
Thank you. Thank you, Claire, for really explaining that to the public. I think it's very important that we all understand the use of medical marijuana. And as a healthcare professional who has a family member with a license,